Sean, just count us in when you're ready.
Hello.
Oh, there she is. Good afternoon. I'd like to call to order the September meeting of the Delaware County Jail Oversight Board. If we could all rise for the Pledge of Allegiance.
Hi, it's Deb Love.
I pledge allegiance to the flag of the United States of America and to the republic in which it stands,
one nation, under the God, indivisible, with liberty and justice for all.
Joining us remotely today is Jonathan Raheem King, Judge Amoroso, and Ms. Deborah Love, in addition to who's here live. And as a administrative point, I'd like to announce we had an executive session yesterday to cover matters of security and other contractual matters. And with that, we'll move on to the public comment at the top of the meeting. So if there's anyone from the public who would like to address the Jail Oversight Board, please do so now. Seeing no one, we'll move on to an approval of the minutes. Is there a motion to approve the August minutes?
Motion.
Thank you, Brian.
Second.
You have a motion and a second. Any questions or comments on the minutes? Hearing none, all in favor? Aye.
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 Hi.
Any opposed? The ayes have it. Is there a motion to approve the reports? Brian,
I make a motion to approve the reports.
we'll take that as a second. Is there any questions or comments on the reports? Hearing none, all in favor? Aye.
Aye.
Any opposed? The ayes have it. All right, Warden Williams.
Thank you very much, and good afternoon, board. Before I dive into the presentation that they'll be queuing up for us, I wanted to make a note that I erroneously added an agenda item as uniform purchase on the agenda. This is something that is already part of our approved budget for 2023. We did go through the county procurement process. It does exceed the $25,000 amount. So that will be proposed later to council, but it is already part of our approved budget. So I will not be speaking on that throughout the presentation. For monthly statistics, our count this morning was 1,217 incarcerated persons, which was a decrease of 34 from last month's meeting. In our weekender program, we had 17 total participants. 15 of those were first timers and 4 were female. We had 587 commitments and 659 discharges within the last month. You can see as we report on our recreation status, we offer full recreation throughout the facility. The listed dates or shifts that are included on this slide are those in which that was an exception. So you can see that we have been predominantly providing full recreation to the population, and we have officially exceeded a year of doing that. We made that significant change to our recreation procedures last year in August. So the population as well as the staff has been able to sustain full recreation. In our training academy, we had a graduation on September 1st, of which you can see class 0723A. They are posing here with the Honorable Judge Richard Lowe, who did administer the oath and spoke to our graduating class. It was very powerful to have yet another judge who was willing to come and engage in these services and meet our staff. It has a very significant impact to us when we are able to see different judges throughout Delaware County who are representatives of the county that we serve. Our staff was very appreciative for the remarks that he provided, and we are exceedingly thankful that judges are continuing to sign up. It sounds like they actually enjoy this process. So we wanted to express our gratitude for all of the judges who have participated participated in that process, including a present board member and a previous board member. So we are looking forward to future graduations, which we have one upcoming. So September 29th, we are anticipating that 17 of our cadets who are currently in training will graduate and become full-time correctional officers. We have another class that is actually starting on September 18th, which is on Monday, and we are recruiting for our class to begin on October 16th. Our class on Monday is one of the largest that we are anticipating having thus far. So we are extraordinarily excited for the new employees to join our facility. Our employees of the month for September, we want to acknowledge and congratulate our case manager, Sophia Riley. She is in the lower right quadrant in the center, posing with her senior case manager, John Swider, and Deputy Warden Daley Falley. We also acknowledged Captain Platt as one of our supervisors. You can see him in the right top quadrant with Chief Smith, as well as Officer Connor and Major Pleasant. We do not have a photograph of Kelly Mullen, who's one of our physician assistants, but we are exceedingly grateful for all of the contributions of these employees. I have to remark again that it is a great pleasure and honor to be able to receive the different nominations. Those are sent to me from different staff members. And in this calendar month, it was a particularly special one because almost every single nomination came from a staff member from a different department. And that speaks volumes for the institution because it means that we're taking note and notice of each other. We're communicating with greater ease and frequency, and we are spending time acknowledging how much each of our departments contributes to the overall safety of the institution. So I thought that was pretty exceptional and wanted to make sure that those individuals were specifically called out for being recognized, not just by the facility, but by other departments that don't directly supervise them. We're still recruiting for employees, and we would love for individuals to join our team. Would like to specifically highlight that we are seeking a human resources manager, a labor relations generalist, a contract compliance monitor, deputy warden of security, substance abuse counselor, wellness instructor, and we are still seeking correctional officers, sergeants, lieutenant, a locksmith, and sanitation crewmen. And you can see I highlighted it because last month, though the wage was not discussed during the jail oversight board meeting, we did talk about the proposed interim agreement that was collaboratively reached by both the county as well as DCPEIU, was able to progress to the membership on 8/29/23, and was also ratified and then adopted by County Council on 9/6 during their public meeting. So what that did was it increased the initial starting wage for our correctional officers, which was previously $21 an hour, increasing that to $24 an hour, which is an enormously significant pay increase and an acknowledgement from this county of the value of George W. Hill Correctional Facility employees. So this was pretty exciting for us. We've been able to start advertising for this rate, and we do believe that this will continue to assist with recruitment efforts. So wanted to thank the Jail Oversight Board as well as County Council for providing that support to our facility.
Yeah, and I will echo your comments. It's certainly a big step. I'm glad we finally got to an agreement there. And just as a point of reference, correct me if I'm wrong, but that 24 an hour is a 50% increase versus what the wages were at the time of the transfer. So it's gone up from 16 an hour to 24 an hour in what, about 16, 18 months.
Yes. So it is significant and something that I think is encouraging for members of the facility. I know that the law enforcement community is broad and expansive, and typically the field of corrections is not always acknowledged as being part of the law enforcement community or the criminal justice system. And it is easy to feel alone, especially within that environment. It can be difficult to work in. We frequently say we go to jail every day. Sometimes staff refer to doing bids themselves. So to have a public acknowledgement and support, it's pretty significant, and that boosts I think, people's meaning, value, and sense of contribution to the county. So much appreciated. I wanted to make sure that I included in this, we have added ourselves to the agenda for the personnel meeting. So this is very encouraging in terms of the wage increase for our correctional officers. What this does is somewhat challenges some of the wages that we have within our hierarchical structure within the facility. And it does challenge some wage compression issues. So I should state that the numbers that are on this slide are proposals. They are not guarantees. This is something that I will be presenting to the personnel board meeting on 9/19, which is next week, but want to do so with the acknowledgement of the Jail Oversight Board. So we did, again, vaguely discuss this last month, that would be part of my proposal for wage compression, but this is more definitive and concrete in some of the numbers. So you'll see 2 wages for different bodies on this slide. That's because those are the largest representation of the 57 budgeted positions that will be requested for the wage increase. So our sergeant rank presently is a $23.10 an hour starting wage, which unfortunately falls below our starting wage for correctional officer. Industry standards typically support that we're 10% above as a correctional sergeant above the correctional officer position. So we will be proposing and requesting an increase of adjusting that rate to $26.50 an hour. Similarly, you would see that then the lieutenants would fall behind as well at $25 an hour, and we would be requesting to increase that wage to $29.25 an hour. So we of course need to go through our approval steps and make sure that we are following suggested guidelines within the county. You can also see that we've got a captain position, majors, fire and safety manager, classification coordinators. One of those positions is presently vacant, and a senior records tech position that is also vacant. Though it's not directly related to this, we do have a vacant position that we would like to promote one of our current staff. And the wage for that current staff member falls below the budgeted posted vacant position. So we will be simultaneously making that request as well. I'm not sure if there are any questions related to that, or if the board does support this proceeding forward next week.
I don't know that we need, explicit discussion on it.
Perfect. Then we will advance. So 2024 budget proposal preview. We still have some ongoing discussions that are related to the budget that will need some further review. So those numbers are being worked on. We have to make a multitude of considerations, but I felt it very important that we at least discuss some of the necessary restructuring in our evaluation for our department in the coming 2024 years. So again, these are proposed. These are not approved. These will be something that I will in future meetings further justify the necessity of the positions in restructuring our organization and agency. Many of them are directly related to the necessary infrastructure developments that will be occurring within the institution to support ongoing processes and procedures with fidelity and compliance to those, as well as being very mindful of some of the changes within the institution. For example, with the increase in cameras, as well as some onboarded software systems that will be necessary for our monitoring, we do need to adapt and modify our IT department and make sure that we are recruiting for individuals who are skilled and competent within those systems. And so some of this may require a title change, which does not have a wage adjustment, but we would be posting different vacancies for currently budgeted positions, such as the MIS manager to a security systems coordinator, and that individual would be able to better support some of the systems that will be onboarded. We want to ensure that we're increasing the department of our classification, which is extraordinarily important to population management. Additionally, we want to expand some of the capacity that we have in the institution, and Delaware County recently named their Director of Veteran Services and Affairs. And we see that as an opportunity within the institution, and classification would typically engage in some of those processes, as well as some jobs coordination. To support the ongoing projects and management of those projects, as well as the onboarding of staff. And I think it's important to discuss that we are extraordinarily fortunate that we have individuals who want to work at our facility, and that recruitment hasn't necessarily been a burden or a challenge, but retention can be. And training must be ongoing in the field of corrections for mitigation risk, as well as making sure that we have employees that feel confident in performing their duties daily. So expanding our training department, as well as supporting them with an additional captain, we think is absolutely necessary for our growing agency with the volume of new employees that we have under 2 years of service within the agency. WellPath. So WellPath is our contracted healthcare provider, and they are
I'm sorry, Warden. I'm trying to Zoom and I'm not very good at it. But with respect to the salaries, and I certainly don't object to the corrections officers making $24 an hour. But I was just wondering, Joanne, maybe you know how that compares with, I mean, look, I know that we have attorneys in the public defender's office or the DA's office or court who are lawyers who do not make that much.
So Controller Phillips is not present, Your Honor.
Oh, okay. Well, then she wouldn't be able to answer that. But it's just something to keep in mind, because the budget is what the county expenses or resources are what they are. So it's just surprising to me that we're at a point where we've got people who are lawyers who have been with the county for years who are making significantly less than that. But maybe that'll be a decision for somebody else, I guess.
Judge Amoroso, I appreciate your comments. And any attorney who would like, they can certainly apply to work as a corrections officer.
Yeah, there you go. That's a great idea.
We are in fact hiring, but somewhat joking aside, it's a challenging environment to hire across the state for corrections officers. And I think the warden has laid out in great detail to you and to the rest how this compares to corrections officers starting salaries in neighboring counties and states. So I think we're doing what we need to do here to make sure we have a fully staffed jail, which is important from a safety perspective.
Thank you. So we have an in-person hiring event next week on the 19th between 9 a.m. and 6 p.m. This will take place at the Residence Inn, 11 Fellowship Drive in Glen Mills, PA. And we are actively recruiting for RNs, LPNs, and mid-level providers. Though our last recruitment event got us quite a few employees, we do still have some vacancies, and it is our goal to be able to fill those remaining vacancies, hopefully at this in-person hiring event. We did have a training class last month that was over 20 for healthcare employees. It was very exciting to see that much interest in the organization as well as correctional healthcare, because it is a very exciting and rewarding field of work. Our restoration to competency program, we will start formally presenting data on this. And I do intend to continue to push this information to our state as well, because we've had a multitude of discussion of this being one of the responsibilities of the state that we are choosing to take on here at Delaware County. So our restoration to competency program started training with Dr. Corinne Kotraba from WellPath, who has set up similar programs in other agencies and jurisdictions. And we were able to mold some of our current foundational mental health program staff, as well as our restoration to competency employees. So they were able to collaborate and discuss process, as well as current services that are available. We will begin services officially in October of 2023. So next month during the Jail Oversight Board meeting, we will have officially started the program with patients enrolled, and we will have started working through some of the kinks along the way to make sure that we're doing all of the appropriate referrals and communication between our partners for the success of this program.
I think if I could pause you there, I want to thank WellPath and the rest of the team to get this up and running as quickly as we have. I'm really excited about this pilot program. I know that there's been discussion about ongoing funding for it, and I certainly welcome state support for this project in light of the fact that it's reducing the burden statewide. And I hope it does become a model for other larger counties that might have a similar challenge of getting people off the wait list to one of the state facilities. But this is great. And again, I want to thank everyone for making it happen.
Thank you. We are really looking forward to it. I also have, a proposal for the board's consideration, and this is something that we had discussed several months back when the Jail Oversight Board supported a proposal, which was later voted on and adopted by Delaware County Council to amend the contract with WellPath to include wage enhancements and the establishment of the jail-based restoration and competency program. However, during that proposal, we omitted the LPN job classification. So we focused on registered nurses as well as NPs, PAs, and we failed to really propose or evaluate the licensed practical nurse job classification. In our review, we're requesting this job classification be addressed for competitive wage rates. And the current hourly midpoint range is $28 an hour. Industry rates would support more competitive rates. And we do have an analysis that WellPath provided that gave several different data points in terms of what would be a competitive wage rate. And collaboratively, we've decided that $34 an hour would get us closer to that competitive wage rate, as well as ensure that we are not overinflating the budget and or creating an additional compression issue since we already corrected the RN wage rate. You can see there in the lower quadrant that there is an anticipated or projected annualized budgetary impact, and the WellPath contract is a pass-through, which means that we have a proposed amount that is budgeted in, but that there is an opportunity for that to fluctuate. It could be less, it could be more. Most of that is typically related to medications that are provided to the population because those vary in costs. But the annualized budgetary impact would be approximately $200,000. And due to this amount, we would still have to go forward with County Council to make sure that they were in agreement with this, should the board support it.
All right, and just to clarify, you're saying that going from 28 to 34 would not create any compression issues with the other wages that were previously supported for change?
Correct.
So I would entertain a motion to support this change in wage for the RNs within this contract.
That's LPNs.
Sorry.
LPNs.
LPNs, I'm sorry. Is there such a motion?
I'll make a motion.
Thank you, Your Honor.
Second.
So any questions, comments on this motion from board members?
I have a question. So if I recall correctly, you said that there are currently 4 of 12 positions available. Is that correct?
It is technically 4.7.
Okay.
4.2, yes.
4.2. So I guess I'm wondering why we're increasing it if you've been able to get employees. I mean, a fair amount. I mean, it's tough to get employees all around, not just LPNs, not just correction. I mean, other than to be in with somebody else.
The reason for the request, Your Honor, is that we historically did not have challenges with recruitment or retention of LPNs. And then we saw wage adjustments kind of across the Commonwealth, as well as travel nursing and agency contracts. And we have since, whereas we had 0 LPN vacancies, increased to 4.2 vacancies within the last month and a half. So that is the driving of the request. Additionally, we failed to do it when we did the other wages related to nursing, specifically in the agency. LPN's predominant task within the institution is to provide medications, and that's an extraordinarily laborsome task within the institution and a very important one.
I don't doubt any of that. So you answered the question to the extent that the vacancies have been pretty recent. So when was the last time and how long, like, were you fully staffed to 12 for the whole year and a half or however long? And then you've seen a drop off recently?
Yes, ma'am.
Okay, so it's been, okay, thank you.
And
This is Deb Love. I would just like to support Warden with those decisions. Those of us in healthcare know that vacancies are happening between agencies, between that and people choosing to get out of healthcare. Salary increases are happening in all settings where practitioners work just to keep them in healthcare. So I wanted to support that decision of the ward. Thank you.
Thank you, Ms. Love. And what I was just going to say is, while I completely appreciate where Your Honor's concern is coming from, obviously we have to be very vigilant around the budget, and I'm mindful of the impact it's going to have. The reality is that this job position really intersects two areas that have been challenged in, hiring and wage increases, which is, as Ms. Love just said, healthcare and in corrections. And in terms of making sure that we're delivering what we need to from a care perspective for those who are in our custody, speed of care is something that is always of kind of heightened mind. So I think we need to make sure that we are fully staffed there. So I do support the motion, and I appreciate that we're raising it, I think, as much as necessary and not exceeding that. Are there any other comments or questions on this motion? All right, hearing none, I'll call it to a vote. All in favor?
Aye.
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 Any opposed? All right, the ayes have it. Thank you, Warden.
Thank you. I failed to include a specific slide, but I wanted to make sure that we announced that we, both in the community as well as in the field of corrections, return to school. So DCIU has been assisting us with the return to school that began last week, and we appreciate their continued support and services to those that are incarcerated while they are still achieving their education process. Towards our goals for 2023, employment and staffing, one of the goals is continue investment in professional development of employees, and we do have some slides further to discuss that, as well as training. We did update some of our staff dining facilities, so we at least did a facelift with a painting of our outside ODR, which now matches our internal ODR. We did the morning stripe as well as the thin blue line and the thin gray line to represent law enforcement support. Though I'm sure that our staff will look forward to very future larger renovations. This was something to demonstrate that we wanted to at least acknowledge that there is a way to improve without maybe getting to full 100% and doing those step-by-step incremental progresses. I wanted to give an update because this was important. Last month, we supported the laundry equipment being purchased. That was also supported by County Council. The purchasing order was completed, and we are so thankful for everybody expediting that, because the lead time on delivery, as you can see, our washers will take 7 to 9 weeks, and our dryers will take 11 to 13 weeks for their delivery and installation into the institution. So it was very important to us to get that completed so that we could get that project taken care of within our laundry services department. So the American Correctional Association hosted their conference in Philadelphia, Pennsylvania from the 10th to the 13th of August. And you can see in that lower left-hand corner, the large seminar room that we were participating in discussion. You can actually see, if you look closely at the video, that they are presenting the colors. Very powerful and impactful to have agencies represented from across the United States at all levels. So the federal, the state, and the county level had representatives. Our facility was extraordinarily fortunate that we were able to have our Health Services Administrator, Kristen Grady, Director of Internal Affairs, John Ned, Compliance Administrator, Sarah Bowles, our Chief Deputy Warden, Adam Smith, and myself present at the conference. And you can see that Director Ned and Sarah actually were able to take a photograph and meet the outgoing director of the American Correctional Association. So it was wonderful to be able to participate and engage in those discussions. We also, in the last month, had our inaugural class of fatherhood presented by Foundation for Delaware County graduate on August 14th. We started with 13 students. We enrolled one additional and had a total of 14 students enrolled. 8 were able to receive their certificates of completion. 4 were released before conclusion, and 2 other students did not meet minimum participation requirements for class. And so it's very interesting. I actually learned throughout this process too that there was a Pennsylvania Act supporting fatherhood and reunification with families. So you can see that as Act number 114 of 2022. And I always find it helpful when I learn to maybe share some of that information with others and why these initiatives are important and supported by law. We have additionally partnered. So Apex, we were able to get the Sheriff's Department to our facility. They did both a tour of our intake department so we could have continued discussions related to court movement as well as transports, and they were able to participate in simulated exercises utilizing the Apex system. And beginning later this month, in concert with Chief Deputy Conti, as well as Sheriff Sanders, we'll be organizing some joint interdepartmental training with the Sheriff's Department to make sure, again, that both of our agencies are supporting each other in best practices. You can see here, we had a very busy month in August. We were also represented at the Pennsylvania Prison Chaplains Association, and Chaplain Kekelia Dunn, who has been a long-standing member, she's also served as a board member at PPCA. She was present, as well as Major Leach, and he was invited to be one of the guest speakers. So he provided 2 different presentations at the conference and was able to engage in some fellowship with other chaplains and administrators from across the state, which is a very powerful learning experience, as well as networking with agencies. His topics included the importance of security support for religious programs to be provided to the incarcerated population, as well as security threat groups and other threats to correctional facilities. And not everybody gets asked to participate as a guest speaker. So we see this as a huge honor and privilege that as our facility has been transitioning, that we are able to engage and support these different organizations and continue to learn. So he was able to sit in and learn a great deal from those other presenters. Medications for opioid use disorder. Today's participation data, and I don't know if you'll find this to be interesting. We had 119 patients enrolled as of today, currently on a medication-assisted treatment, which you can see is 9.78% of the current population. And we only believe this to be expanding in the future as we continue efforts with induction. But that is representative, at least a bit, of what our community is experiencing in terms of substance use disorders. So of the 119, we have 100 on buprenorphine, 11 on Sublocade. So that's 111 who are prescribed either the oral or the injectable form of buprenorphine, and 8 who are presently prescribed methadone. And so based on, though it wasn't a formal request, last month's discussion, we have the new patients who have been enrolled each month. And then at the bottom, you can see the number of total patients served within that calendar month. So you can see last month it was 110. We are already above that right now with 119. And again, we do anticipate that this will continue as the program expands. Cost recovery. So this is an important slide, especially because I do have an ask of the Inmate Welfare Fund. So those top items go to the County General Fund, and the bottom represents the current volume of the Inmate Welfare Fund as of August 31st. So we are over $3,787,000, which leads to my Inmate Welfare Fund request. We are continuing to look for ways to augment or invest in materials or services for the population that exceed the minimum standard requirements for correctional agencies. And we went through multiple source quotes to find a mattress that would be sturdier, more substantial in its padding, more durable, increase in comfort, and easier to maintain, clean, and sanitize. And we were able to find a mattress that was more significant than the one that is presently provided in the institution. Our previous mattress is around 4 inches. This one's 6 inches thick with a more substantial built-in pillow. It is also a more transparent material. It is tamper resistant. Nothing is tamper proof, but tamper resistant, and it will allow for cleaning and sanitation to happen easily. And we would be able to observe any soiling or anything like that. We would order 2,000 mattresses to replace all in the facility and do that in one bulk order, reducing the freight costs. And the lowest quote that we were able to receive, which was provided to the Jail Oversight Board, actually all of the quotes were provided for review to make sure we were abiding by that process, was for $147,760 for 2,000 mattresses to be presented. And so I present that today for your consideration and review.
Thank you, Warden. I want to mention there was a comment from a board member that I think is worth raising for the rest of the board, which was to consider only looking at the portion of what this purchase would be versus the baseline purchase for the standard mattress as what we would put to the Inmate Welfare Fund, and exclude what would be the baseline mattress cost. So I guess to say that more succinctly, what we would be asking for Inmate Welfare Fund dollars would only be that sort of over and above purchase versus standard. And so I guess just to kind of get the conversation going, is there a motion to, you know what, before we make a motion, why don't we discuss that portion
Well,
so that we know what to kind of.
I guess I'd have to say I'm supportive of using all the inmate welfare, but for the entire purchase, because it's my understanding we wouldn't be buying all new mattresses. We would leave them and you'd replace them as they were needed to be replaced, so many per year. So this is really going above and beyond. We're giving everybody a benefit through the money that is meant to serve their welfare, but it's something that the county wouldn't otherwise have to do. We would be buying 50, 100 per year to replace the destroyed ones or the ones that were deteriorated. So I don't have a personal problem using, I think it's appropriate to use the Inmate Welfare Fund to fund all of it. That's my think.
I had a question. I thought, and maybe I misunderstood, that the warden indicated that mattresses were being replaced at the rate of like 448 per month. Was that not what I understood?
That is
Warden? If that's the case, then no mattress should be older than 4 months old. So while I understand we want to go above and beyond, and that these mattresses actually might last longer, which would be a benefit going forward, it seems to me that we've got a facility with no mattress older than 4 months that and we don't know that they'll last longer, just hope that they will, that a purchase, even from the welfare fund, should be done on a more incremental level to see if this really, it does do the things that you hope that it does, which is reduce the number of mattresses you need to buy to replace it, and give them a greater comfort with the pillow and are cleanable and more clear for people to be able to see contraband or whatever, that the cover can't be removed, rather than $147,000 to purchase 2,000 new mattresses. When, like I said, if the numbers are correct, there can't be a mattress there older than 4 months.
Your Honor, just to unpack your comment a little bit. So I think I would test the math on that. If they're replacing 48 a month and there are 2,000.
You're right. You are right about that.
Yeah, okay,
I
so
was
there,
thinking,
yeah, there are 2,000 mattresses. So 2,000 divided by 50 is 20. So
yeah, you're
at a couple of years over which they would be.
well, a year and yes, some.
Well, I think
Nonetheless,
Your Honor, I think I understand the point, which is why replace a mattress that may have been replaced yesterday to go to one extreme. My guess, and I don't want to presuppose the answer to the warden, I'll put it to you. I'm guessing that you're looking at a bulk purchase where we're going to get a much better price by replacing in one fell swoop all of them versus if we were to just ask for 50 of them, I don't think you're going to get the same sort of bulk discount that we're getting. So I think that might be one problem with, the sort of view of we'll buy 50 at a time. The other is I'm just guessing kind of from a practical perspective, if you've got 50 inmates who have this really nice mattress with a pillow and you got, 1,150 who have the old one, you get into an equity perspective problem. So I think it's a good comment, Your Honor, but I think there might be some challenges to take that approach.
not sure what the equity issue would be, but that aside, and again, I don't know, you're using 147,000, and it is inmate money that is for their benefit. But it's with the idea that it's going to ultimately be a county expenditure. Because ultimately, once this is done, it will become a county expenditure and part of the prison budget, I assume. So going forward, I don't know how, well, maybe I should ask this. Warden, how much is the difference between the cost of the current mattresses and the cost of the upgraded mattresses?
So we got a bulk pricing on the per mattress, and we have a little bit more work to do to determine what it would be if we were ordering in the quantities that we're presently ordering to evaluate maybe apples to apples, oranges to oranges. So I am committed to getting that information. In terms of some of the other concerns that you had raised, yes, we would have to replace in the future, but likely at a significantly reduced rate of replacement because these are a higher quality or more comfortable, durable mattress. And so we are already sustaining this as part of the county budget. So I do understand the concern, and we would continue to work with pricing. We do pricing and procurement continuously because we are a 24/7, 365 agency that's attempting to meet and exceed the needs of the population. Finally, in terms of equity, because I do agree with all of the statements that Councilman Madden offered, who decides who's going to get the better mattress?
I don't know.
And when you state those out, we have to be very kind of diligent in making sure that we're doing that in a way that is fair and equitable, and that we're getting them out to the population with reduced wait times so that we don't have one population getting something conceivably better than another person, because
You're already newer ones. So, but again, so what is the cost difference between, I mean, these run, $75 a mattress. What are we paying for the ones you currently use?
The ones that we currently use are a higher price, again, because we are actually buying them less frequently in lower volumes. A lot of the price increases related to freight and shipping, as well as the construction or labor associated with the material cost of making the mattress.
So I want to go back to the controller's point, which I think it's a really good one, and not honestly what I initially was kind of thinking, but the point is we wouldn't be replacing all of these mattresses right now. And so in terms of, the inmate welfare versus what the normal course would be, everyone would be getting a brand new improved upon mattress. And I think there is some validity to that being, to the welfare of the inmates that purchase. Now, I think what we may want to look at is what is the difference in the durability of these mattresses. What we may see is for future replacements, maybe these are lasting 3 times as long or something, and the replacement going forward might very well be appropriate for a county expenditure. But doing this one fell swoop, brand new, higher quality mattress, I think there is some merit to this being fully an inmate welfare fund.
Yeah, I do, I acknowledge Judge Amoroso's thinking here, and I understand it and it makes sense, but in 2 points. One is this is an immediate savings to the county budget because it's not coming from the general fund or Fund 2. So, and I think it's appropriate. And the other thing I'm thinking, just for quality of time in George W. Hill, I'm going to imagine that people spend a fair amount of time on their mattress, and it's like your only piece of furniture that you really have. So I think there's something to be said for just improving that through this. And if it turns out that we find that it doesn't last as long or something, we'll we can regroup in the future. But I think it's appropriate to use the funds now to do this, and we'll have a benchmark going forward.
Right.
But I do acknowledge Judge Amoroso's comments, and I do understand, why buy something if we don't have to. But in this case, I think we're getting something different.
Yeah, we'd in fact be buying these at a cheaper price than we're currently buying the average mattress. Other board members want to weigh in on this? Any thoughts?
Yeah, just kind of piggyback off what Controller Phillips was saying, to utilize the inmate welfare fund for a quality of life issue for the inmates. As a community member watching these board meetings, we see a lot of projects with very, very high price tags, right? All of them, necessary security projects and building projects and millions of dollars. So when we have things like this brought to us, like the exercise equipment, that directly benefits the inmates, a better mattress that can directly benefit the inmates. I think it's just so important, for you and your team to continue to bring those little things to the board that directly affects, the daily lives of the inmates within the facility. And the fact that we have that welfare fund and the abundance of it, I feel is an opportunity to, assist in those things that otherwise may not be appropriate for the county to fund in other areas. That may be people's opinion, but to have that welfare fund that we can do those things to try to improve that quality of life. And it's an amazing, that ripple effect of that quality of life that improves security, that improves people's engagement in programming, that hopefully, improves recidivism, right? Big picture things. So no, it has my full support.
Other thoughts from board members?
Well, okay, as I expressed previously to some of you, I'm in favor of providing more comfortable, more sanitary, more tamper-resistant mattress. However, I have concerns about the entire cost being paid by the inmate welfare fund. I think there's a responsibility requirement that at least we provide a mattress. And it would seem to me that what we should look at then is the bulk rate for the current mattress we use, the bulk rate for these better mattresses, and to the extent the bulk rate for these new mattresses, so-called Barker mattresses, exceeds the cost of the bulk rate for the mattress we're currently supplying, that additional amount would be an appropriate expenditure by the inmate welfare fund, because that would be providing the marginal improvement, which the county is not required to give. While these monies, and I know there's a lot of it in the inmate welfare fund, it's for the welfare of the inmates. And I don't think it should be used to pay what is a county obligation.
Thank you, Your Honor. And I totally appreciate that perspective. And I don't think there's necessarily a right answer here, but I do kind of go back to what the controller said. I mean, the reality is we wouldn't be replacing all of these mattresses right now. So doing so, whether it's with the old mattress or the new mattress type, regardless, that is an expenditure we wouldn't be doing. So I think that baseline is really, buying 50 mattresses at a time. Instead, we're buying 2,000 right now. So I think where I'm on it is, I think this one bulk purchase to me is appropriate for the inmate welfare fund. But going forward, as we replace these in normal course, that continues to be a normal course expenditure of the county. But again, I totally understand that others may see this differently. Any other thoughts here before perhaps someone makes a motion?
If not, I would make a motion to, I guess we're recommending purchase of the 2,000 mattresses from the inmate welfare fund. I still support that motion.
Second.
We have a motion and a second. Any further questions or comments before we put this to a vote?
I do have a question. Would it
Yes,
be
Ron.
possible to get a review of this by our solicitor and where an opinion as whether this is appropriate or not?
Yeah, so perhaps we can make this, yeah, or if we have our Jail Oversight Board solicitor here. Carlton, I don't know if you have anything that you'd like to provide at this point, or we can also make the motion subject to solicitor approval.
Subject to solicitor.
Okay, sure. So
Thank you.
if you'd like to amend your motion.
Or just it's subject to, from the inmate welfare fund, subject to solicitor's approval.
Such
Second.
is appropriate for,
Yes, as appropriate.
does that satisfy Your Honor? Yeah. Any other comments before we put it to motion or to a vote? Hearing none, all in favor?
Aye.
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 Any opposed? All right, the ayes have it. Thank you, Your Honor.
Thank you very much. Are there any additional questions from the board for me before I welcome our Administrator of Programs and Reentry up for the next presentation?
Anything further from board members?
All right, well, I'm not going anywhere, so
All right.
I'll happily hop back up if needed.
Thank you,
I
Warden.
assume you have a quorum because I'm going to need to cut out. This is
We-
Judge Ambrose.
We do. Thank you, Your Honor, for letting us know.
All right, you bet. Thank you.
Thank you, Warden. Good evening, members of the board and the public. On the first slide, you'll see our new visitation schedule that kicked off on Monday. And in the blue column are our video visiting hours, which remain free of charge to the population. And in the yellow column are our new in-person visiting hours. The enhancements of the schedule include 1 hour in-person visits, an AM and PM option for each housing unit. In-person visits can now have up to 3 visitors per visit, and we now have an increased capacity to accommodate 20 visits per time slot. As a reminder to the public, visits will continue to require an online sign-up. Sign-ups must be signed up 2 days in advance and no more than 7 days in advance.
I just want to pause there because this is a pretty significant change for inmate experience. I don't know if there's any thoughts or comments from board members.
How are they filling up? Are the visits filling up right away, or how is that?
As of yesterday, we had 37 in-person visits scheduled. So that just shows us that the system is up and running. And as the week continues, we will see that increase because they have up to 2 days to schedule.
And I just had one other question. Is everybody facile in getting online to do that? I'm afraid if my husband had to visit me, I would be there by myself. So
Fortunately, we've had the online signups for about a year and a half.
Okay.
So I believe that friends and family are more comfortable with the system. And if not, they'll just call the facility and staff will walk them through the
Okay,
process.
That's good to know. Thank you.
With the increase in the length and the amount of visits, what any effect as far as staffing goes?
We did modify some of our staffing schedules to make sure that we were able to accommodate. We had these discussions well in advance. So we are able to sustain this, which was part of the reason why we waited to be able to expand these visits. And we don't anticipate that being a problem for us. We are still also, though it's not included on this, entertaining our legal visits. That has never stopped. So this is in addition to the legal visits and social visits we've been able to expand.
Well, good. What I'd say is, I think if this is logistically working well, and certainly I want to hear if there are any, concerns or problems that may arise with the change. But look, I think, incarceration shouldn't mean being isolated from friends and loved ones if we can do it securely. So I'm glad to see that we're making this more accessible with longer time periods.
And we have been receiving positive feedback from friends and family with the hour visit. Prior to that, in-person visits were 30 minutes.
Excellent.
Educational service highlights. In the month of August, 13 incarcerated learners earned a GED. That is the highest month of achievement since electronic administration in 2014. And in total, we have 55 GEDs that were earned this year. With this milestone, it's important to recognize our two academic instructors, Ms. Martin and Ms. Gaspari, who paved the way for academic success. Delaware County Community College course, Student Success, graduated 20 students. For the year, 39 incarcerated learners earned college credits at Delaware County Community College. Not only did they receive college credits, but they are officially enrolled into Delaware County Community College, and we encourage them to continue their education upon release. In partnership with Penn State Brandywine, the Inside Out Prison Exchange Program began on Tuesday, August 29th. For our new viewers, the Inside Out Prison Exchange is a global program that invites college students to a correctional facility to take a college-level course with the incarcerated population. This is our second time facilitating the program, and we look forward to celebrating in the closing ceremony. And of course, all the members of the board are invited to attend. Religious services, volunteerism, and substance use. In religious services for the month, we facilitated 38 religious services with 353 participants. 19 incarcerated individuals received a pastoral visit. Volunteerism. In the month of August, 19 different community service provider volunteers delivered service to the population. We have been very grateful and are very fortunate to have continuous community support, which enhance program opportunities within the facility. Saturday, August 26th, Major Leach and the Training Academy hosted a volunteer training. Over 20 individuals attended training. The training class was comprised of professionals in higher education, wellness, mental health, substance use, reentry, faith-based organizations, and family relationships. Now that the individuals have completed their mandatory training, they can now begin implementation of services. Substance use. In the month of August, the Prison Reentry Education Program, referred to as PrEP, that is our in-house drug and alcohol use program, had 124 participants, including 50 new enrollments. The next bullet point, I apologize, is a typo. What that should say is, for the month of August, we facilitated 7 AA classes. We have weekly volunteers that come in, facilitate for the male and female population. Workforce development and reentry highlights. In workforce development, 30 incarcerated persons received a Flagger certification. 20 persons received a Spartan chemical certification. 5 incarcerated persons received a customer service certification, and 7 incarcerated persons completed the first step 4-week vocational program. Reentry highlights. The Maternity Care Coalition provided individual support for 4 mothers in the month of August. The support includes resources for the baby and extended case management services. Thresholds organization provided soft skill training sessions to 15 participants in the month of August. We have a new reentry service. Last month, we connected with the Institute for Community Justice, referred to as ICJ, to provide post-release services. The post-release services include digital literacy, GED support, healthcare services, workforce initiatives, and a wireless partnership program. To ensure a warm handoff, services are referral-based and appointments are scheduled prior to release. Thank you. May I answer any questions?
Any questions for the deputy warden?
Just looking, this past August was the highest amount of Narcan that's been distributed, inmates discharging. Is there any correlation with the large amount of people that are on medicated assisted treatment within the facility? Like, do you think an enhanced education for individuals to understand the importance of having that medication when they leave, or?
We've been continually educating staff of the importance of the Narcan as well as the population to try to eliminate that stigma of picking up the Narcan. So I think continued education has helped increase those numbers.
Right. Thank you.
I also had a question. This is terrific. And when I think of where we started and getting a presentation and actually seeing the pride on your face for how you've leaned into this so much, it's really is impressive for all of you. But do we have a way of tracking how the people that are participating in these programs are doing out in the world, or hopefully, that you're not seeing them again because they're being successful outside George W. Hill?
So recidivism is constantly, I think, at the forefront of all of our minds. And ultimately, we want to provide services that are efficacious and reduce a return to incarceration. We are, through collaboration with CJAB right now, we're engaging with PHMC, who is going to be assisting with some of that analysis related to recidivism. It's a bit of an enigma. So some of our systems aren't linked appropriately, from a computer standpoint. That's not typically what most agencies or criminal justice systems have been tracking historically. So we're going to be working with them to really design or try to figure out the impact of a lot of these programs. And it should say that there could be some correlation, but that's not necessarily causation, because there are multiple different reasons as to why somebody might return to incarceration. But that we do see, if you can bolster somebody with skills, provide certifications, and they have supports in the community, that risk or rate does drop, dramatically. So I have always appreciated the initiative that Administrator Shaw has taken, as well as many other administrators in the facility, to make sure that we are constantly evaluating what we're offering. And we're getting continuous feedback from the population. I think Ms. Shaw and her team has also made sure to do town hall meetings and surveys with the population. What programs and services do you want? What would you be interested in participating in? What would fill some of those gaps for you? So we've also been evolving to be very population specific, I think. But we'll have some of that information through that partnership with PHMC.
That's great. I mean, I know it's got to grow incrementally. The programs get created, they get participated in, and then you find out how it's working. But as you grow on this, it would be good data. But I don't want to make you bean counters either while you're all doing it. But it would be good to know that there's a benefit. But you'd think it would have to education, the certificates and all. Give somebody a leg up when they get out. So thank you for that.
no matter what, and of course, we are interested in the impact that we have. Our commitment is to release better, make safer, healthier communities and provide resources, opportunities and support that somebody might not otherwise have. And I think that the program support division of the institution has done an extraordinary job to make sure that we are maintaining to that commitment.
Anything else from board members? All right. Thank you. Moving on to any new business for today. Any new business from board members? If not, we'll move to our second round of public comment. Are there any members of the public who would like to address the board at this time? Hearing none. Any further board member comments for today?
None for me.
Thank you, Ms. Love. I would like to announce that there was, per the mandate of this board, we had an unannounced visit of the George W. Hill facility last month, and a report from that visit will be posted in the very near future. So be on the lookout for that on the website. And I'd like to thank the board members who were able to participate in that. If nothing further, I would entertain a motion to adjourn.
Motion?
Motion.
Second.
All in favor?
Aye.
Aye.
Any opposed? We are adjourned. Thank you all.
Thank you.